Hello and welcome back. I'm Dr. Kristen Casey, licensed clinical psychologist, here to answer your questions about becoming a psychologist. One question that I received was, what is a day in your life as a psychologist? I honestly did not know how to answer this because every psychologist has a different sort of day. So I figured it would be the most helpful to let you know my own personal experience and then also shed light on potentially what other psychologists might be doing with their time. So for starters, right now I work in private practice. I have a small private practice with a couple of therapy patients. I also do assessments for a couple of different referral agencies. I also provide education through various platforms, and I'm also writing a book. So I'm doing a bunch of different things, and I also have goals as well to do other things. For example, I'm hoping to publish my book sometime soon. If I could increase my motivation a little bit, and then also create some e-courses for people who might not have access to textbooks, therapy, things like that, just for educational purposes. So I usually wake up, I take my dog to the park, I go for a run if I can, or a walk with my husband, make coffee. I really try to eat very healthy throughout the day so that I could keep my energy going. And my day involves either seeing therapy patients. I usually see them for 45 minutes, 30 to 45 minutes, depending on what they need. I also do assessments as well. Those could range from anywhere from like 60 minutes to 4 hours, depending on the type of testing. And then when I'm writing my book, I'm writing, right? And then I also consult with a bunch of different colleagues that I have. So it's either other people who are in psychology or people who are outside of psychology who might need some consultation on a client. For example, sometimes primary care physicians will call and say, hey, what do you think about this patient? Do you think they need therapy? Can you provide a recommendation? So in private practice, you kind of make your own schedule based on, how many clients you have and really what you decide to do. It's kind of really exciting to have your own schedule, and also it could be daunting because you really don't know how to fill your time if you're just starting out. And with therapy, so depending on how many therapy patients I have a day, I could see them back to back. I could see them every other hour. Again, it all depends on you. Then if you work in community settings, which I have in the past, you really respond to the needs of the clinic. So you might see therapy patients all day long. You might see some therapy patients, some assessment patients. You also might be in a consultative role. So I don't think consultative is a word, Kristen. Geez. Maybe a consultation role. Geez. Yeah, Thanksgiving is tomorrow, so I'm a little out there. And in that you would really provide other doctors with, consultation services. For example, if you worked in primary care, and you see warm handoffs, people who go to their primary care physician and then also experience depression and anxiety. So you might see them after they see their primary care physician, things like that. You could also be involved in supervision. So just like we had to go through internship and fellowship experiences, there are a lot of people who provide supervision to interns, right? So you might be involved in that, reviewing tapes, reviewing feedback, providing them with critical feedback that they need. I think supervision is one of the most important things, and because we shape our field, right? So if we're not helping to shape new psychologists, then we're not really sure where the field is going. So I feel like it's an ethical duty of everyone. Not many people like supervision, but depends on if you're willing to train, right? Train other people. You could also give seminars if you work in community health. So a lot of times people need CEs to keep their license going. And a lot of times people will provide training experiences, and you might be one of those people to provide training on a level of something of your expertise. For example, I really like sleep stuff, so I might give a presentation on CBT for insomnia. So it really just depends. There are also people who work in prison, right? So you could work in a federal prison, a state prison, things like that. You could also work in a forensic hospital doing evaluations for competency to stand trial and not guilty by reason of insanity. So it really depends. So those sort of positions, again, you're responding to the needs of the clinic, whereas private practice, you're responding to yourself, essentially. So if the clinic at a community-based setting says, oh my gosh, we have all these therapy patients, you need to see like 30 hours a week or maintain your quota of 30 hours a week, you might have to see 30 patients a week, or You might have to see a certain amount to get up to that 30 mark. So every clinic has a different need, and that need usually dictates your day-to-day. So I notice that I feel the most fulfilled when I have a little bit of everything. So if I'm able to see therapy patients, if I'm able to do some assessments, if I'm also able to educate and spread mental health awareness, that's usually when I feel the most fulfilled, I guess is a good word. I also really enjoy teaching and training because I've had some really great supervisors, like really, really great supervisors, and I just feel like it's helpful to pay it forward. So I hope this helped. If you have any more questions, feel free to comment, like, and subscribe. See you soon.